My mother was always the source of unconditional love. That was magnified with my son. When she became a grandmother, that was like the ultimate for her. They were happily retired. My dad played golf, my mom played bridge. It got to the point where she just got to be tired. They found that she had a condition called aortic stenosis. So she decided to go ahead with this operation. It is a low-risk procedure. But what happened was, over the next several days, they moved her to rehab, and she started to deteriorate. She went to the emergency room, and she was kept on a ventilator for a couple of days until I could be there and my dad was there. But she had died in the emergency room. That was the end of the story. Her death should not have happened. My brother and I realized continuity of care is critical. So we talked about it and said, well, why isn't there just some simple measure of how sick you are that someone could look at and understand what the course of someone's stay was like, what their trajectory was? And that was the beginning of the Rothman Index.
My family means everything to me. They are why I get up in the morning. They are why I do my job. I definitely want my kids to see that mom is working hard to make a difference in the world, because I would love for them to grow up and want to do the same type of thing, make the world a better place. My interest in healthcare took me by surprise, really. My mother was actually a nurse for a very long time, and so sometimes you resist the path that your parents were on. Once I grabbed on to nursing, I never looked back. It just felt right. I have loved working at Northside, every single different role I've had. Things from patient care tech to bedside nurse to manager to clinical nurse specialist. I really, really enjoyed being at the bedside, but as a clinical nurse specialist, you still can make such an impact to patients' lives. You may not get to see those changes in person, but you see them in the data. You see the metrics change, and you know that you're impacting not just one life, but you're impacting many, many lives.
All right, yeah, so let's go ahead and get rapid response involved. Let's go ahead and see if they want to do another bolus maybe. Make sure they're aware of their nutrition changes and things like that.
Yep, sounds like a plan.
One of the things that my brother and I realized as we started talking about this was that people knew if there was a crisis, but they didn't understand if there was slower deterioration. A lot of talk today is on the advances in technology, but it really is the nurse and his or her capability in terms of observing the patient, which makes all the difference. When a nurse goes into a room, they're doing a very structured evaluation of the patient's condition. It's called the head-to-toe nursing assessment. They're checking respiration, your neurological system, your gastrointestinal system. They're looking at your skin. They're doing a psychosocial evaluation. The nurses understand that something's going on, even if the vital signs don't show it. And they had all this data that they'd gathered on patients, but it was in effect in an electronic filing cabinet. You could look it up, but it wasn't integrated in any way. The Rothman Index is a constructed model taking nursing assessments, vital signs, and lab tests, and incorporating them into a single measure of patient acuity. The way that we present this data is in the form of a graph. So you see acuity as a function of time, and you can see if someone is getting better or if they're getting worse. The idea was If you could show a doctor, you could show a nurse that someone was deteriorating earlier, you could allow them to get to the bedside before there was a crisis and give them an opportunity to avert that crisis.
Sounds great. And just call me if there's any changes, okay?
All right, thank you so much. I appreciate it.
We wanted to make sure that we were able to take what the Rothman Index has and really work that into a way that works for the bedside nurse and for the providers and helps to escalate care. Without that, you're looking at recognizing a patient's deterioration when their blood pressure starts crashing, when their heart rate goes down, when you start breathing quickly. Sometimes, unfortunately, that can be a little too late. We came up with this program called DETER, standing for detect, evaluate, triage, evaluate again, and then respond. Through the use of the DETER program and the Rothman Index, we've seen a number of improved outcomes, including a reduction in code blue events outside of the ED and ICU, which is a huge number that you want to see. We've seen a reduction in mortality and also been able to help identify patients sooner that may need a palliative care consult.
Sit here at this
Yeah.
table here.
Have a seat. Yeah.
I think it's important to remember that these are numbers, they're data, they're metrics on a screen. However, what it really is patient lives. It's a person, it's a human being, it's someone's mother, it's someone's sister, it's someone's husband, it's someone's child. You're thinking about patients' lives and their outcomes, and that, at the end of the day, is what it's all about.
It's been a long road, but every once in a while, I just think about the fact that I could make a difference in someone's life that I'll never know, help some family through a difficult time, and it's humbling. If we could prevent what happened to our mother from happening to one other person, it would have been worth it. She inspired this, and people say that my mother would have felt good about that. I think she would have.